crucial role in the lives of consumers of our mental health services. Management at all levels supports clinicians in working with families. Connecting with carers is everybody's business.
It's important for doctors to share information with carers. Ward rounds and outpatient clinics are good places to do this.
As a consumer, I attended several family meetings. They improve relationships at home and help my recovery.
I appreciate being part of the mental health team to improve the outcomes of Aboriginal families. Family is very important to our people.
Connecting with families is everybody's business. I greet them and make them feel comfortable.
It is essential for senior managers to work with their staff in supporting carers. Connecting with carers is everybody's business.
I tell my staff that initial support for carers can be as simple as listening to their concerns and giving them an information pack.
When I visited area health services across the state, I was impressed by how many clinicians are connecting with families.
Participating in psychoeducation groups is often life-changing for families. Staff can learn so much from families.
As a carer, it is vital to be able to talk to health professionals, to be listened to, and to be part of the team. For me, connecting with carers is essential.
Team leaders know that time spent working with carers leads to better outcomes for the whole family. Connecting with carers is everybody's business.
At first, working with families can be really quite daunting, but it is good to work with the carers. It has really positive outcomes for the people we're looking after. Connecting with carers is everybody's business.
The Pyramid of Family Care was developed as a framework to guide adult mental health clinicians in connecting with carers as part of their everyday routine practice. The pyramid has 5 levels. Level 1, connect and assess. This is the most important level. It forms a strong foundation on which all the other levels are built. It has a number of key tasks. Firstly, introduce yourself and your role in the mental health service. Explain the importance of a strong partnership between families, carers and the mental health service. Obtain families' contact details. Remember, access to something as basic as a telephone number has proven life-saving. Assess the urgent and basic needs of the family and then move on to establish a safety plan which will optimise safety for each and every family member. Once safety is achieved, further assessment of individual and family needs can be undertaken. Orientate families and carers to the mental health service, especially contact numbers for a crisis. And finally, begin to develop a support plan involving other parts of your health service or other agencies as needed. Remember, family work is about sharing the load. Level 2 builds on Level 1. Level 2 is about general education. Families and carers tell us they need information about some key areas. Navigating the often complex mental health system. Information about illness and treatment. Information about the Mental Health Act and the rights of consumers and carers. And information about resources such as our partner services for carers. And don't forget the children. They also need appropriate information and education. Together, levels 1 and 2 form the minimum level of care that all clinicians can offer all families and carers. Connecting with carers is everybody's business. Now let's look at levels 3, 4 and 5, the higher level pyramid interventions. Some, but certainly not all families, will require higher level interventions to help them tackle more complex issues. Level 3 is about psychoeducation. This involves providing the family with support and coping skills to help them live with more serious mental illness. Psychoeducation often involves multi-family group sessions. Level 4 involves consultation. When families continue to face unrelenting challenges, it is essential to seek new ideas from a clinician with specialist family skills. This can rekindle hope for carers, consumers and the treating team. Level 5 is about family therapy and is the last of the higher level interventions. Family therapy is needed by only a small minority of families. Families are helped to develop an understanding of themselves and the way they interact or dance around a problem. This opens up opportunities for change and may improve outcomes for everyone in the family. So now let's have a look at the pyramid in action.